If you tell people that they have to lower their cholesterol and we have a pill to do it and it will protect you from having heart disease, which everyone's being told this is hereditary, what you guys don't know is that the moment you start taking the statin drug itself lowers the amount of cholesterol your body can make no matter how much fat you're consuming.
Right.
And did you know at home, everybody, that cholesterol is the backbone required by your hormone glands in your body to make most of your hormones? I mean, you need cholesterol to make testosterone, men. 6 months later, you're going to go to your medical doctor and tell them, look, doc, I'm glad my cholesterol numbers are better, but I just have no interest in sleeping with my wife. The MD says, oh, that's okay. You're in your 40s. This is normal for your age. It's a little blue pill to help you with that. When in fact, the cholesterol drug you started 6 months ago doesn't allow your body to now make testosterone because you need cholesterol to make testosterone. And said fat is bad for you, causes cholesterol to go up, which will cause you to have heart disease and increase your risk of that. Take this pill, you take that pill, now you lower your amount of cholesterol to offset the side effects of the statin drug and the low-fat diet that you're now on. Okay, that's one. Did you know serotonin, the hormone in every male and female's body, needs cholesterol to be made?
Right.
So now you can't make serotonin. Serotonin is your happy, feel-good hormone. Now you can't make it because you don't have cholesterol to make enough of it. What are you going to report to your medical doctor within 6 months to a year after starting your statin drug? You're going to tell them you're depressed, you're anxious, and guess what your MD's going to tell you? That's okay. This is normal. A lot of people experience this. A lot of people in my practice have this after 6 months of coming in here and getting their cholesterol checked. We put them on this. Antidepressants are still the number one most prescribed drugs on the planet next to cholesterol drugs. Can't you see how that fits in? All right. So what happens when you tell the world to stop eating so much salt? Well, your kidneys take all of your blood and they filter it into urine and they excrete all whatever it is that you don't need in the body. It removes all the excess water out of your body and cleanses the body. Your kidneys have cells inside of them to convert uric acid into urine and filter out your blood so you can urinate. Your kidneys can't even filter anything in your blood without sodium, potassium pumps. Salt. Okay, so these are called salt potassium pumps. Okay,
Yeah.
well, your kidneys require salt to even work. Deprive the kidneys of salt, guess what happens to your kidney function? Do the pumps get better or worse? What do you think? And what happens when your body starts retaining water because your kidneys no longer can filter out urine out of your body? Retain it. Will the added water in your body put pressure on your blood vessels and on your heart or reduce it?
Yeah, pressure.
It increases it. Increased water, increased pressure. If you increase pressure, what's going to happen to your blood pressure? Now, you're not eating salt and your blood pressure is going up. If you tell the whole society to restrict from the time you're born how much salt you consume, all of you, because you're mammals and designed the same way and all have salt potassium pumps in your kidneys, you all over time will produce high blood pressure. And your medical doctor's got to take your blood pressure and go, oh, your blood pressure's high. We got to actually give you a high blood pressure. And make sure you don't eat salt, Mary. The FDA in America says the maximum amount of salt every day that an American should consume is 2,300 milligrams a day. What does the American Heart Association say? That's in the same country. It says we do not agree with the FDA's salt amount. They believe it should be 1,100 milligrams a day. That's less than half of what the FDA says. How come they don't agree? The Tel Aviv University study in 2016, they published the lowest amount of salt a day that keeps your blood pressure normal, they found in their study, is 6,000 milligrams.
Oh,
it's 6,000 to 9,000. They even said as you get to 9,000 milligrams, the results of blood pressure were better. What amount of salt is in every saline fluid bag in a hospital? Medical profession knows salt's bad for you. They tell you it's bad for you. An ambulance came to pick you up. Before you get to the hospital, you will have an IV drip of salt water going into your veins.
Yeah.
Before you even get there. Before a doctor walks in the room, does an EKG or ECG or any other testing on you, they're going to give you salt without question. They know you need salt. Now, why do they know you need salt?
Why do they know we need it? Yeah.
Because they know everybody on Earth is eating less salt than they need.